Very good evening, friends. Meeting again in the session of Stuart Close philosophy, and we're discussing the chapter number 11, the symptomatology. It is a very important chapter because it defines what type of symptoms are exactly important in order to prescribe for the patient. Unless we know the type of symptom, it is not possible to have exactly the totality. And so he started with chapter with some knowledge about homeopathic materia medica and how it is different than modern materia medica. Whatever is happened in provings, it is written in the very expressions as happened over there in the materia medicas. And this is how Hahnemann started writing down the materia medica, and he prepared the two volumes of two volumes of materia medica pura, and later on the chronic diseases. We used to listen the patients because patient also expresses the symptoms. In fact, it is the language of internal disturbance of vital force, which is actually a disease which is invisible, but we know it only because we know the external manifestations. We know signs and symptoms because of which we know that a person is ill. So this is how he has started. This was just an introduction. And then he started explaining about actual symptomatology. And while explaining the symptomatology, he explains what do you mean by exact symptom. There are two varieties. Symptom is nothing but an expression of internal disturbed vital force, but which has twofold existence. First is functional, where the symptoms has a meaning. A patient tells you his feelings, his sensations, his functions. It alters the sensations and functions, and he expresses either I am having headache, I am having pain in stomach, I am having pain in abdomen, I am having pain in joint. All the symptoms which are functional in manifestations without any production of sign or a pathology. Those are labeled as the subjective symptoms, and that's why subjective symptoms are defined as the symptoms which are felt by the patient and not observable to an observer, all called as subjective symptoms. These symptoms, in fact, are the most important symptoms in the case because those are the symptoms which defines the remedy, because it defines the individuality. From modern science of point of view, these subjective symptoms doesn't have any meaning. From their point of view, the subjective, instead of subjective, the objectives are important. But from our point of view, the objective symptoms are nothing but the symptoms which are visible to the naked eye. They are felt by the patient and observable to an observer are called as signs or objective symptoms. Generally, they are the end states, the end pathology. So there might be cyst, there might be what, there might be an eczema. These are expressions of the disease which are in the material form. These warts, you cannot differentiate on the basis of what? One patient from another patient. You cannot differentiate one patient of corn from another patient of corn only on the basis of corns. And that's why from homeopathic point of view, the objective symptoms plays very little role as compared to the subjective symptoms. If the patient comes to you with pathology, then you have to believe on the subjective symptoms which are prior to the development of the objective symptom. You have to take into detailed history so that you can get those subjective symptoms from the patient. So this explanation which he tried to explain over there, the importance of subjectives and objectives over there, and then he started turning about to the totality of the symptoms. First paragraph of this totality of the symptoms on page number 151 we have finished. And totality of the symptoms, as Hahnemann have rightly defined in the seventh aphorism, it is an outwardly reflected picture of the internal essence of the disease, that is of the affection of vital force. And this is very clear. He says that whatever comes out is nothing but the expression of the deranged vital force. And that is the only language with which we understand the disorder. So this is what we have learned. Let us go with the page number 152. And he says again, by taking the help of aphorisms, Hahnemann in the Organon paragraph 6 says, the ensemble or totality of these available signs and symptoms represents in its full extent of the disease itself. That is, they constitute the true and only form of which the mind is capable of conceiving. This sentence is from 5th edition of Organon of Medicine. In the 6th, it is little bit changed, but having the same meaning. When you get the portrait of disease, he has explained the concept of portrait of disease in the aphorism number 6. Portrait is nothing but the similar picture. In Marathi, we called hubehub chitra, exact picture, is nothing but the portrait of the disease. Hahnemann says portrait is important, but out of this portrait, some features are common, some features are indications of disease, some features are very specific to the individual. You have to differentiate. Unless we differentiate, it is not possible to find it out a remedy. And that's why he says that, yes, portrait is necessary, but you have to filter that portrait. Then you have to look for totality of the symptom. And how to look for that? Then he starts 7th aphorism and he says, after removing the causa occasionalis, whatever remains out of that, whatever is the expressed symptomatology of the internal derangement of vital force is the totality of the symptom. And that totality is the sole guide in the formation of a, or in the prescription, or in the finding it out the remedy. And this is what Hahnemannian concept is. So in the sixth aphorism, he has explained the concept portrait. Portrait covers everything, considering normal, abnormal, everything. In totality, it gets exactly the abnormal features. The expression has twofold meaning. It represents the disease and it also represents the remedy, as language represents the thoughts. Number one, the totality of the symptoms means first the totality of each individual symptom. See, these are the very important things which he is mentioning. The totality of the symptoms means first the totality of each individual symptom. What it means? Totality of each individual symptom. What do you mean by it? It means that symptom should be complete. It is not like that patient comes and says, doctor, I am having headache, give the medicine. It doesn't carry any sense. When he says, doctor, I'm having very severe headache since yesterday and it starts right from here and then it goes up and it has settled over my right hand. There is severe pain and it is associated with severe pain in right upper extremity, and patient's age, she is a female and she is around 50. Now it has meaning. This is called as totality of individual symptom. Here you get the location, you get the sensation, you get the concomitant, you get the modality, everything. That symptom becomes total, that symptom becomes complete, ultimately becoming characteristic. What is the remedy which you are going to give? Very simple. If you get this totality, you should be on the one symptom, but which has a complete value. No, spigelia is left-sided. This is right-sided. Spigelia, the headache settles on left side.
Sanguinaria?
Yes, it is Sanguinaria canadensis. Because climacteric age. Second important, it has a similar location, starts in occiput, goes to the top, settles over right eye. It is very neuralgic, throbbing type of pain is there, associated with the right shoulder pains, right hand pains. Very typical of Sanguinaria canadensis. See, here you don't require 10 symptoms. This one symptoms, when all its parameters gives you a totality of that specific symptom, and that is the meaning of this sentence. The totality of symptoms means first the totality of each individual symptom. You must be able to get that individuality in that specific symptom. It should not be a numerical totality. Numerical totality means you have 100 symptoms, but all are vague. It doesn't give you anything. You are in jungle. You cannot find it out the road. But if you get one single symptom, which is having proper location, which is having proper sensation, which is having proper modality, which is having proper concomitants, the symptom itself is so strong that which guides you towards the individuality. And that's why he says very perfectly in the first, the totality of symptoms means the first, the totality of each individual symptom. So when you are dealing with the patients, taking the cases, my suggestion to you, when you take the case history, cheap complaints, give the importance. You ask the details. You ask exactly where is the location. You ask them, show it. You ask them what type of pain is there. You ask them what are the things which aggravates and what are the things which ameliorates. You ask them, so along with this, do you get anything? Then that symptom becomes a complete, which has a meaning. So it should not be vague. So whenever you are taking the case, you should have the quality of symptoms so that you can get a individuality. A single symptom is more than a single fact. बघा किती छान म्हणलं, very nicely has explained all those things. Close philosophy, why it takes long time? Because one sentence has a lot of philosophy. What he says, the single symptom is more than a single fact. Yes, finish. This type of symptom is you are getting the individuality. This is fact which you are observing in the patient. Patient is telling you the fact and you are finding it out the simillimum. It is a fact with its history, with its origin, its location, its progress or direction, and its conditions. A single symptom with all its modality, all its parameters, the location, the sensation, the modality, the concomitant, everything matters. Everything is important. And that's why one symptom, if you get a proper, which is based upon facts and which has a characteristic meaning, then it is sufficient. Every complete symptom has three essential elements: location, sensation, and modality. This is prior to the Bonning-Hussein. Prior to the Bonning-Hussein, this was the definition of the complete symptom. Bonning-Hussein has added one more thing. A symptom becomes complete when it has location, it has sensation, it has modalities, and it has concomitants. So doctrine of concomitance is added by Bonning-Hussein. And that is again a one important thing. If there is no correlation of the main chief complaint with the concomitant symptom, it indicates very clearly the remedy. That's why it is too important. Every complete symptom has three essential elements: location, sensation, modality. By location, it means the part, organ, tissue, or functions of the body or mind in which the symptoms appears. You get a patient, and patient says, patient is having the very typical, he comes to you with the diagnosis, he is having pyloric stenosis. And he is having projectile vomiting. Now, you must know the remedies which are directly action on pylorus. Location is important. So you must know, that's why the Boger's synoptic key is very important, because Boger's synoptic key defines it in a proper manner. Also, even the Borix Medica, you can get that in the first few sentences. So which is the remedy which is having directly action on pylorus, pyloric stenosis? Any remedy, do you know? Open the Borix Medica, just open and find it out. Is there any remedy named as ornithogalum? You can find it out, ornithogalum. If it is there with you, just open the Borix Medica. It is, in fact, it is the key of the homeopathic practice. It has a very typical action on pylorus. It is very important remedy for CA stomach. It is very important remedy for gastritis, but pylorus with projectile vomiting. I have cured one case of pyloric stenosis whose weight was 32. Within span of 2 months, he went to 40 after giving the ornithogalum 30. I have presented that case. So this is a wonderful remedy. If you know the exact location, you can find it out a remedy. Very important. That's why location has its own meaning. So you should not overlook where exactly the patient is having complaint. So this is what he wants to explain by location is mean the part, organ, tissue or functions of the body or mind in which the symptoms appear. Patient comes to you with acute pancreatitis. I am treating a case of pancreatitis. You know the action directly on pancreas, then you know remedies which has direct action on pancreas. The patient was admitted for 2.5 months out of 4 months in Bharati Vidyapit Hospital, Pune. Patient was never taken a food more than a rice, nothing more than that in 4 months. And he has lost nearly about the 15, 16 kg. He was not getting cured. I started him directly on iris versicolor. Open the iris versicolor. See the what is the sentence, how it starts in iris versicolor, the Boric starts. What is the sentence in Boric's Matramedy? The first sentence only. See, it has action on thyroid, it has action on pancreas, it has action on salivary glands. You must know it. Location plays a very vital role. And that's the meaning of location. So my suggestion to all of you, read the Boric's Matramedy for 1,000 times. I know you're going to laugh, but it is the need. It is the need. Then you catch, then you'll find it out a location where exactly the remedy has specific action. Then you get the results. This fellow I started with iris versicolor and he is able to eat the whole food now. He is taking chapati, he is taking sabji, everything. Within span of first 15 days. This is too important. One has to understand the importance of location. Second, by sensation is meant the impression or consciousness of an impression upon the central system through the medium of sensory or apparent nerve, through one of the organs of senses, a feeling, a state of consciousness produced by an external stimulus, or by some change in the internal state of the body. Sensation is two types. Because of some external stimulus, the sensation happens, it is individualistic. Our patient is having some disorder and he says in his own words, his own sensations. Someone says it is, doctor, I could not walk certain distance. My both legs become so heavy, I have to sit down and becomes numb. Then I have to wait for some time. Then again, I walk for certain distance. And again, I get very severe pain in both lower extremities. It becomes heavy, numb. Diagnosis is two. Either there might be a spinal canal stenosis or there might be a diabetic neuropathy. What is the remedy which has that specific sensation? If you know that, then you will treat that patient. Otherwise, you not. Anyone which is the remedy. Any remedy which is having the heaviness and numbness in lower extremities after walking with sciatica. It is Naphyllum. Gnaphyllum. Naphyllum. If you get that specifically the sensation, you can give the remedy and you get the price for it because your patient gets recovery. Is it there? Have you opened the books? My suggestion is that always keep Allen's keynotes and Boric's Matramedica along with this so that you can learn a lot. Even repertory, you can keep it yourself. So you can get, yes, is it there? The heaviness and numbness in lower extremities after walking with sciatica. Sciatica with numbness. This is the wonderful remedy. So sensation has its own meaning. A sensation may also be purely mental or physical reactions such as fright, fear, anger, grief, or jealousy. Varieties of reactions. Sensation expresses through the fear. Someone sees there is just a lizard and there is a reaction as if some tiger is coming. Very exaggerated reaction to the situation. You can find it out. What is there? So everyone's reactions are different because everyone's sensations are different. The sensitivity varies from individual to individual. In some cases, it might be more fear. Some patients are absolutely fearless. Some patients are destructive. They kills that lizard. Such types of persons are also there. So reaction is individualistic because sensations are different. There might be a grief for some persons. It might be a grief for some persons. It might not be. It doesn't matter. Some persons feels jealous about others. Some never feels. It's okay. It happens. They accept the reality. So there is a variation in the reactions because variations in the sensitivity, variations at the level of sensation. And these are the things which we must know. We must know what the patient is saying. We must be good listener. You must able to listen what is happening. Your senses should be sound enough so that you can catch the sensitivity of the patient. Patient is coughing over there outside, but he is coughing in typical manner. He is coughing like this. It should touch your mind and catch the rubric and prescribe for the patient. This is too important because you are able to catch what the patient is expressing through his sensation. He is coughing like this again and again in your OPD. Cough paroxysmal consisting of 2 or 3 coughs in succession. You might get Merck, pulsatilla, belladonna, only few remedies. So this is what he wants to explain. This is what is the case taking is there. When you are dealing with the patient, it is not just putting a question and writing it down. This is called as perceiving the patient. Only at the chief symptom level, you are perceiving what is characteristic for which you can prescribe. You must able to catch that. And that is more at the level of sensations. Third is modality. The factors which modifies the symptom are called as modality. This is the definition of modality. What he says, by modalities, we refer to the circumstances and conditions that affect or modify symptom, of which the conditions of aggravations and amelioration are the most important. Dr. William Borick well said, the modalities of the drug are the pathognomic symptoms of the materia medica. Modalities many times give you exactly the remedy. Very easily you can catch the remedy. Very easily. On the basis of modalities, it is very easy to reach to the right remedy. There are varieties of modalities. There might be time modalities. There might be circumstances which causes certain things, that circumstantial modalities are there. They might be aggravating, there might be ameliorating. There might be certain things, patient feels better by pressure. In some patient, it is aggravated by pressure. It is very important. So modalities are the things with which it is easy to reach to the remedy. If you get the proper modality, it is a big guide. Patient comes to you at midnight, at 1 o'clock with asthma, with expectoration, which is sticky, mucoid, and he's suffering from breathlessness. And he's sitting and he's breathing and he's coughing and he says, doctor, see this type of cough, it is very difficult to raise and throw away. You get two important things. What you get? You get the expectoration, which is stringy, tough, tenacious. You get 1M modality, Kali arsenicos or Kali bichromicum. Both remedies are having that modality. So you are reaching to the 1 or 2 remedies on the basis of modalities, on the basis of sensations. It has that much of value. In homeopathy, we have a lot of meaning to the modality. If the patient is expressing anything, just see what he is expressing, what are the modalities, what aggravates the symptom, what ameliorates the symptom, because those are the things where you get the individuality. The chief complaint in the pathology never explain anything, but the modalities defines you the individuality, which is very, very essential. So these are 3 important factors which he meant explained over there. And then he says, by aggravation is mean an increase or intensification of already existing symptom by some appreciable circumstance or the condition. So there is a change of weather, sudden change. Now again it is becoming little bit wet, damp, cloudy. Your remedy changes because weather aggravates. Certain who are asthmatic starts getting the cough again. See, you get the remedy directly. Yes, these are the modalities with which you can catch the cloudy weather aggravates asthma, aggravated cloudy weather. But there are some patients where this cloudy weather, whenever comes, they are happy. They feels better. Doctor, I like this weather. I don't have asthma. I don't have joint pains in this weather. Now it becomes more specific for you. Which are remedies? Cloudy weather ameliorates.
Causticum, Noxvum.
And one more. Very correct. Causticum, Naxvomica. And third,
Medorinum.
no, Hepar sulfuricum. More marked is Hepar sulfuricum. These are three important where you get the damp wet weather ameliorates, clear fine weather aggravates. See, the modalities brings you to the three remedies only because modalities are strong. And this is what he wants to explain over there. I think we'll stop over here. Tomorrow we'll continue with the rest of the things. So we have learned certain aspects. This philosophy is wonderful philosophy, which gives you exact practical aspects about it. And we will learn a lot. It takes a long time to finish this chapter, but it is very important from practice point of view. So that's all for today. We'll meet again at 8 o'clock with a continuation of Barata carbonicum in today's session. Thank you.
Hello, sir.
Yes.
Which was the remedy for pyloric stenosis?
Ornithogalum.
Okay. Thank you.
Ornithogalum.
सर स्पेलिंग बता देंगे
ORNI ornitho THO GALUM. पेज नंबर का है. Very small remedy, organ remedy, but cancer mayadam. 489 page number on Borix Matra Medica 489. If it is old board.
थैंक यू सर
Okay. So that's all for today. We'll meet again at 8 o'clock. Good evening.